Thanks to Gerber for helping us with our kids' nutritional journey. Busy parents everywhere can breathe a little easier. But what about children who can't breathe that easily? Those with chronic asthma or allergies? We can't always protect our kids against environmental triggers like pollen and dust and chemicals, so what can we do? Access Health correspondent Amber Milt went on location to find out.
Today, we're raising awareness about chronic asthma and the struggles many parents face in having to deal with this condition on a daily basis. Let's hear from a woman who knows about this condition all too well.
Personally, I've spent the last 15 years of my career actually in the space of allergy and asthma, and I'm also the mother of 5, 4 of whom have allergies and or asthma. So there are actually 7 million American children that currently have a diagnosis of asthma, and it's the most common chronic childhood condition as well as one of the costliest. On average, there are about 14 million missed school days each year attributed to asthma, and that of course inhibits those parents from also attending work.
I'm here in New York City, a hotbed of potential environmental asthma triggers at Allergy and Asthma Associates of Murray Hill, to meet with Dr. Purvi Parikh, who treats hundreds of little ones suffering from asthma and allergies each year. Dr. Parikh, can you give us an overview of the different types of childhood asthma and some of the traditional treatments?
Childhood asthma comes in many forms. The most common type in children is allergic asthma, whether it be dust or mold, pollen, cat, dog, sometimes even food can trigger it. Another very common type is a viral-induced asthma in children. So things such as the common cold or the flu or even some bacterial infections can trigger it. Also, children are predisposed to exercise-induced asthma. If the physical exertion is heavy enough, that can also trigger symptoms in them. And then things as subtle as weather changes or humidity can also get children into trouble with their asthma. Traditional treatments are inhalers and controller medicines. Usually they contain a steroid, but they may be a steroid plus another medication. When children are in more trouble, such as when they have a flare-up, they may need even heavier medications, such as prednisone by mouth or even IV steroids.
Meet Josephine Melendez and her 3.5-year-old daughter, Valerie. They've been seeing Dr. Purvi Parikh for 6 months now and aren't sure if the treatments are working.
We've been struggling for a very long time since she was born, 6 months, with asthma and chronic allergies. At first, I wasn't sure with Valerie's breathing that it was asthma or allergies. It's just that I had to literally keep a journal and actually write down every movement since Valerie was 6 months.
Well, you know, I think that it's always important, first and foremost, to have a conversation with your physician about what's going on in your environment, about what you're seeing with the symptoms, how they may be changing over time. Keeping a diary of the symptoms and when they seem to be worse or better is very important so that you can have those informed, educated conversations with your clinician. And then once you have that, I think it's very important that you be tested to know exactly what your triggers are. We always say avoidance is the best treatment for asthma if you can avoid those triggers. But the truth is we don't live in a bubble. So there's no way to completely avoid the triggers. So it's a matter of how do you then also employ treatments like medications most effectively to manage the symptoms.
When you spray an inhaler in your mouth, part of it does get wasted. So you're not really getting the full dose. An average person using the best technique only gets 60% of their asthma medication with just the inhaler alone.
After I saw a specialist, she recommended a nebulizer machine that has a mask, and I have to control a toddler, a growing toddler, to stay with the mask for 15 minutes until the solution airs out or evaporates within her lungs. Now that was challenging within itself because of course, you know, this is all new to Valerie, and she's like, what is this? What is going on? The machine is making noises. It was very time consuming, you know, with a regular growing toddler. She has to go to school, I have to go to work. It's just definitely not an option for me.
Now, another type of traditional medication is a nebulizer machine, which does help a little bit more because the steam kind of helps the patient get the medicine in their lungs, but this is not very time efficient. So often a nebulizer treatment can take up to 10 minutes, and generally our medicines need to be used at least twice a day. So as you can see, it can really eat into time, and it can also be be difficult in young children to have them sit still for that long. A machine can be scary for them.
If you're trying to give a toddler a nebulizer treatment and use that mask, it's intimidating. It's scary for children.
I went back to Dr. Parikh and I told her what was my issues, what was my concerns, especially since I wasn't feeling like she was getting all her entire dosage. So she had recommended using an actual pump that came with like a child chamber.
The chamber helps increase lung deposition. So that means more than 60% of the medication is actually reaching where it needs to go, especially into your smaller airways. The mask, it's very soft, it's non-irritating to their face. The nice aspect for babies is that there's even a slot for a pacifier. This is so nice that you can even use it when the child is sleeping, so that way the parent doesn't have to worry about the child being scared or fighting them off to even get the medication inside.
Using this chamber, it helps a lot, and I see the results. And Valerie, I would have to say, has gotten used to the whole chamber and the pump. She actually likes it. She reminds me now. I'm very pleased with that.
So now with the Inspire chamber, it really is a much more user-friendly product that allows families to administer the medication without that fear.
So it gives me peace of mind that the medication that I've prescribed is actually reaching where it needs to go, because then I can't make decisions on whether or not this is the right medication if I don't know if the child is actually receiving it or not.
At Allergy and Asthma Network, we're very excited about new technologies, especially technologies that help families to have a quality of life that they wouldn't have otherwise. The network really focuses on how we can better raise awareness of the conditions of allergy and asthma, but also educate patients and families. Our magazine, Allergy and Asthma Today, is a great resource for patient-friendly, medically accurate information. Also, our website, allergyasthmanetwork.org. So we take medically accurate information and bring it down to a very patient-friendly basis. It really is about feeling empowered and not limiting your child's activity because of asthma. Because the truth is, if a child's on the right medication and they're well controlled, they should have no limitations to playing outside or playing a sport, swimming, doing everything every other child would like to do without asthma.
Now, if your child has asthma, I want to share these important resources with you once again. That's inspirechamber.com and allergyasthmanetwork.com. And of course, you can always find more information, including these resources, by logging on to our website at accesshealth.tv. And don't forget to check us out on Twitter and Facebook.